Hey everyone, and welcome. If you're a medical coding student, you know that mastering CPT codes is, well, it's everything. So today, we're going to pull back the curtain on a really important one, CPT code 62380. And trust me, by the time we're done here, you're going to feel way more confident about what it is, when to use it, and how to report it correctly.
Okay, so let's just jump right into a real-world scenario. Imagine this. A surgeon's report lands on your desk. You see it's a spinal procedure, it's minimally invasive, it's for the lower back. So, what's the code? Right? That's the question. And that is exactly the puzzle that CPT code 62380 is built to solve.
All right, let's meet the star of the show, code 62380. The official name is percutaneous endoscopic decompression. So let's really unpack that. Percutaneous just means through the skin. Think a super small incision, not a big open surgery. Endoscopic means the surgeon's using an endoscope, basically a thin tube with a tiny camera and light on the end. And decompression, that just means they're relieving pressure. So you mash all that together and what do you get? This code is for a super precise, minimally invasive procedure in the lower back where the surgeon uses a camera to go in and relieve pressure on a nerve. Simple as that.
All right, so to really get a handle on any code, you got to know what work the surgeon is actually doing. So first up, let's break down the what, the specific surgical moves that are all wrapped up in 62380. So the whole goal here is to make more room for those pinched nerves, right? And to do that, the surgeon has a few moves up their sleeve. They might do a discectomy, which means they remove a piece of a bulging disc. Or maybe a laminotomy, where they shave off a tiny bit of bone called the lamina. Or even a foraminotomy, which is just widening the little doorway where the nerve leaves the spine. Now here's the crucial part for you, as a future coder. CPT code 62380 covers any of these things, or even all of them, as long as they're happening at the same spinal level.
Okay, so we've got the what down. But believe it or not, the how is just as important for picking the right code. This next piece is all about the tech, the specific way the surgeon sees what they're doing. And this is what really makes this code special.
Okay, people. This slide right here, this is the absolute key to understanding 62380. It is all about the view. This isn't a case where the surgeon is just looking at an x-ray on a screen and estimating. No way. They are using an endoscope, that little camera, to get a direct, live video feed from inside the patient's spine. So when you're reading a report and you see words like endoscopic or direct visualization, a big light bulb should go off in your head. That is your signal for 62380.
You know, the easiest way to think about 62380 is like it's an all-inclusive package deal. And for anyone learning to code, getting your head around what's bundled inside a code is, well, it's a game changer. It's how you avoid major billing mistakes down the line.
So what exactly is in this all-inclusive package? Well, it covers using the endoscope itself, obviously. It covers the main event, decompressing the nerves, and it covers any of that bone or disc work we just talked about. You know, the discectomy, laminotomy, whatever it took to get the job done. It's all in there.
And here's the part you absolutely have to burn into your memory. You can't bill for these things separately. You just can't. If you use 62380, you don't get to add another code for the laminotomy. You don't get to add one for using the scope. It is all baked in. Getting this right is absolutely fundamental. All right. Like any good game, every CPT code has rules, and 62380 is no exception. Knowing these little limitations is really what makes you a sharp coder. So let's dive into the rules of the road for this one.
I want you to remember one number, just one. You only report 62380 times once per lumbar interspace. That's it. It doesn't matter how much stuff the surgeon does at that one level. If it's all happening between L4 and L5, for example, it's one code, period. Now, this is a spot where a lot of new coders get tripped up. They think, wait, the report says they worked on the left side and the right side, so that's two, right? Nope. The code itself, by definition, covers work on one side, that's unilateral, or both sides, bilateral. So even if the operative report says the work was bilateral, it's still just one unit of 62380 for that single interspace.
You know, a huge part of coding is knowing which code not to use. So let's put 62380 into its family tree, so to speak. We're going to see how it stacks up against some of its procedural cousins.
And this table just lays it all out, crystal clear. See, up top, you've got our code, 62380. Percutaneous, endoscopic, minimally invasive. Then you look below at codes like 63020, and that's a whole different ballgame. That's for an open procedure, a bigger incision, no endoscope. The surgeon is just looking in there with their own eyes. Same goal,
decompression, but a totally different approach means a totally different code.
Okay, if you're going to write one thing down from this whole session, this is it. This is the golden rule, right from the CPT guidelines. It means your choice always boils down to two simple questions. 1, how did the surgeon get in there? Was it percutaneous or open? And 2, how did they see what they were doing, with an endoscope or without? You answer those two things and you'll land on the right code family every single time.
Okay, we have covered a ton of ground, so let's wrap it all up with a super simple checklist. Think of this as your quick check for 62380 anytime you're looking at a report.
Let's run a quick drill. Imagine you're reading a report. It says, a percutaneous endoscopic laminotomy was performed for decompression at the L4-L5 lumbar interspace. Let's run it through our list. Number 1, is the approach percutaneous? Check. 2, is the visualization endoscopic and direct? Check. 3, is the location a lumbar interspace? Yep, L4, L5. And 4, are you coding it just once for that level? You bet. That's a perfect textbook 6238 euro. See how easy that is?
And there you have it. That is the complete breakdown of CPT code 62380. You know the what, the how, the where, and the rules. So you've got the theory down pat. The real question is, are you ready to open up a real surgeon's operative report and spot this code in the wild? I think you are. You've got all the tools you need. Thanks for tuning in.